tell you my own story. Long story short, I was as if they were my own family. It started the journey like that. But now, because I am managing too many things, I have got lost in my journey. But the end of the day, when I see, I come back again. This is one place where it keeps me. Who has watched that Formula One movie? Okay, in that movie, why I tell some things like that is somewhere we all connect. In one space, people talk so much about manifestations, talk about meditation, so many things, no? As I learn is, if you do something so much with Shraddha and Bhakti, putting all your focus, you will go from this beta wave to alpha wave without your knowledge. See, they talk so much about alpha. I was thinking how alpha wave is something where time and space gets out of anybody's control. Means, say suppose you do so much hard work, in 2-3 years you may manifest something. But if you go to that alpha wave, that 2-3 years will become 3 months, 6 months. That place where you don't know, you will lose control of your body and mind, you go to one space. So, because I do a lot of spiritual readings, books, all that. So, end of the day, he says in that movie, when I drive my vehicle, I get lost, I forget myself. For me, everything looks, like open. You have gone to one more world. He uses that word, so it connected to me so much. When I do embryo transfer, same thing happens. I get lost in that. I don't know what happens to me in that minute. So everybody will have somewhere our strength to connect. So if we keep pursuing that, even say suppose you all are having family. So how I read in MBBS time, simply reading 110 hours. Now if I feel if I had not had this knowledge, that 10 hours I would have read in 1 hour. See, you are along with your family, you see, suddenly they say, no, when you stop smoking, you will go and preach the whole world, don't smoke, don't smoke. The other person will feel nuisance about us. Maybe you may feel today, but my intention is very simple. Just, there is something where you can, if you immerse deeply, you forget about time and space. There, you can call it divine energy, you can tell it cosmos, you can tell it God, whatever you believe will come there. Our energy, we can do 10, that energy will do 100. So, anything you do, I always tell even watchmen, I respect them a lot because I can't do his work at all, standing outside. So any work, it can be that's what in China, Japan, they have become so popular because even watchman, when he does his work, he puts total his focus. So God comes there. God doesn't matter where, big work, small work. He sees how best in given work that person can deliver. So getting back all of you to face. So when I come here, I become that another place for me. When I start talking, she will be coming and telling, Madam, time I going. So it became like that, somewhere I understood after seeing that movie. Oh yeah, when I do it, when I talk, I forget about time and space. So that is because of all of you. See, if I don't see anybody, where will I go to that field of alpha? So I'll clap for each of you. Lot of value. So let me put my best and see what you can go home with. So you all have come for a reason, right? So now, just because when we have 4 or 5 classes or 6 classes. So I want to cover total fertility perspective of change your idea of how you view fertility. You should see, basically end of the day, exam you will 100% pass, each of you. That is for sure. But when some patient sits in front of you, how best you can get them delivered, sending with a baby in their hand is your way of thinking. That's all. Simple. I don't know why God has sent them here. I don't know why. How they will go home with the baby. How best we can do is what I'll be talking to you in these terms. So for this, physiology is very important. If you don't know physiology, how much ever I talk, it won't. So my essence here is to create that physiology for you, so that you can tackle any situation later. So for that, we will go with the in 5 minutes I want to finish this. I don't want to go back to the previous class and get stuck there, because I have so much to deliver today. So just you keep answering, because if you don't connect to this, and try whenever, see, when I come, I may be 4-5 minutes late, discuss whenever I come, no, previous class you write somebody, you all discuss, you become friends, idi kadu, so that 5 minutes also we won't waste. Do that, you will also feel good. So we'll just start like this, okay? We know that on day 21 of cycle, CL cyst, what it releases? Hormones. Fast, you only have to tell now. What hormones CL cyst releases? Estrogen, progesterone. Estrogen how much? Progesterone how much after ovulation? Estrogen more than 50, progesterone
1 to 5.
Yeah, 3. Not 1. 1 is not ovulated. 3 is ovulated. 5 is strong ovulation. Okay. And now what happens if there is no pregnancy? Luteal follicular transition. Okay. So this luteinization happens, it dies, and then estrogen becomes how much? Lowest estrogen? Less than 3. And then progesterone? What happens then? Yeah, because now the endometrium will cry. I am not able to maintain. I can't feel the loss of hormones. So it starts crying. Endometrium sheds. So endometrium, what it becomes? So here we will see endometrium. What is endometrium here? Yeah, secretory. It's ready for the baby's bed. It is waiting. It is secreted and it's waiting to catch the baby, but no pregnancy. Then what it will? It cries now. So it will be around normally 7 mm is the cutoff. Ideally, in a normal lady, if you see the percentile, 90 percentile will have around 8, 9, 10. That's the normal thick it is. So now it becomes how much on day 2? 3 mm, less than 4. So on scan, what happens on that day? Or scan, what happens? CL cyst, do you see on day 2? It is collapsed, no? Collapsed CL cyst, you may see small. And what about other follicles? All are there, okay? So PCOS means more than 20, POR more than 4, less than 4, in between normal. Yeah, now each of them starts. This is day 2. Day 5, what happens? One of the follicles gets selected. All are less than 10 mm, 100% it should be. What if one follicle is 11 or 12 mm? What do you think it is? Simple cyst is not for us. For a person who knows science, one follicle is early recruited. Which group it happens? Super. In a lady where the cycles are short, luteal phase is 14 days, follicular phase is 14 days. But in a lady who has 20 days cycles, where the things, what gets shortened? So 20 days means 28 days. So 14 days minus 8, how much? 6. We are very bad at maths. 6. So she ovulates on 6th day only. If she ovulates on 6th day, it is 20 mm that day. So day 2, what will happen? It will be around, follicles will be around 14, 12. So that is the, so as a doctors, when you see in a scan on day 2, any follicle more than 10 mm, 11, 12, rest 1 or 2, then you have to be very careful with her, because less than 4 is POR and early recruitment is there, 20 days cycle. Then what will happen if you leave her? 0 follicles, menopause, she may be 23, 24 also. She will lose eggs. If she wants her own, even if she is not married, you as doctor should tell her for oocyte cryopreservation now, because previously we didn't have oocyte. 10 years before, if somebody asked you oocyte cryopreservation, I used to slap them. What are you people doing? Less than 30 years, you all get married, have kid. Normally was my own mantra, but now I have changed. Why? Because in my own family, 30, 35, nobody wants to get married. What to do? It's left to them. See, they can't simply marry now if they don't meet proper partner. Who am I? My work is now, oocyte cryopreservation has 10 years may have become so good. Before, why I used to not tell this, oocyte cryopreservation used to, studies showed that the babies born from that oocyte, which is preserved, can lead to cancers. So I was so much, because see, end of the day, we are all small people. If you see 40 years from now, if we produce all kids who are 40 years not IQ less, it's our moral responsibility not even to go there. See, we are humans, no, it's not today. See, in China, they are doing biobags. They don't even want surrogacy. One baby is already born. Where is nature ending? But anything which starts, no, at least 1 lakh kids has to happen, then only I'll start telling to my people. That's my, very clear in my brain. Time tested. Anything new comes, I will not test. If it gives a bad out, I'm very strict on that principle. So oocyte cryopreservation, now that cancer risk, whatever was there, is negated now. In between, for 3-4 years they were working on it. So okay, technology also, we can't simply use it in a bad way, because we are responsible for a healthy younger generation. So this is how we have to understand what we are doing. So that is one. Now early recruitment, more than 14 mm with less short cycle, with all symptoms of hypoestrogenic status, and then you should not waste their time ideally. But if she is already married, continuously tell her to try naturally also. See, even menopause, no, within 1 year they can conceive naturally, some studies have proved. So you should always encourage them to try naturally. There is no fertility is there, I will do all that, no. That natural trial door is always open for them. Fine? Then this is one. So on day 5, one follicle will become 11 or 12 and it starts secreting estrogen. Estrogen more than what gives negative feedback? More than 100. 100 closes the window. There is, you know the idea of window period? That's a very important scientific word. Window period means the window is open. Why I am telling so much about that is, at that point when the window is open, you can just catch that follicles and then you can make all the follicles grow. Once this window period closes, you give gonadotropin, whatever, the follicles won't come. Here, when this window period day 2 to day 5, it's all open, all receptors are waiting for your hormones or your tablets, so that it will all come. Like morning you are very fresh. You can hear same thing if I tell you in the evening after nice food. Oh madam, edo cheptunnaru nidra vastundi. True, no? It's not only for you, even for me it has happened. So time also matters. So now your windows are all open for the knowledge. Right? So even they have a window period where they will hear the signals. You give gonadotropin, very good dose, they get 10 follicles. So this is what is called as window period. See, if you ask definition of window period, anybody can tell definition. I also don't want to mark. Threshold of that, there is blah blah blah. You understood, no? Threshold of each follicle, all that is there. I know as a definition for writing you read. I am not here to tell you about definitions and pamper you. I am here to tell physiology. So now after I tell your definition will make sense for you. Otherwise, adedo window period anta threshold anta. Deentlone manam stuck అయిపోతాం. We should know logic. For everything you know logic, no answers will free flow. You can write window period if you know the logic. If they ask short note, you can make it a long note. And you can write the truth of it. So this is the window period, but the window is open where basically each follicle have a threshold. That little more than threshold, if you give the dose, all follicles will come. Window closes when one follicle becomes dominant. That means when estrogen becomes more than 100, what that follicle does, it closes window for others. Got my point? So that it escapes out of that house. It jumps out of that window and it closes the window for others. So others are all stuck. Now in IVF and IUI, if you want 2 follicles, you have to keep the window so that 2 follicles go out. For IUI, unexplained infertility, not for everybody. PCOS, 1 window is enough, one follicle. For unexplained 2 means double the pregnancies. Like that, if you have to manage, because your end of the day, unexplained infertility, she is already releasing 1 follicle. What are you doing by giving ovulation induction? Your idea is to get 2 follicles. For PCOS, 1 follicle, monofollicle. So in IVF, you want 20 follicles. So you are opening the window. Got my point? Now this has given 100. It has told that HPO axis, grandfather, grandmother, to suppress. It closes the window. Then this opens and this keep 2 mm growing, and then on 14 mm when it is on 8th or 9th day, it releases estrogen 200 now. This 200 for 50 hours LH surge will happen. You should know this mantra very well. These 2 points, when the window closes, that is negative, that is called as negative feedback. Now when from 100 say 200, when it becomes a positive feedback for LH surge. Are you with me?
Yes.
We know 2 feedbacks of a follicle. Follicle releases estrogen. Estrogen has 1 negative feedback. We know 1 positive feedback. Negative feedback first when 100. So it makes all the follicles window closes. After 2 days, it goes to positive feedback, where it wants LH surge to happen. So 200 for 50 hours it is hold. Then from brain HPO. So first HPO axis will have a negative surge, followed by 2 days only positive. See, you should remember like this, if people who confuses first positive surge or negative surge, because I am telling you mantras where I only had these problems. I am not telling you. I also have fallen many times and learned. No? How we learn is like a story. Always remember LH surge is positive feedback. So positive feedbacks happen and during LH surge. Before that, sometime negative has to happen. So what is first? Easy, no? You don't have to read now. Folliculogenesis. I am trying to make it very easy for you. Easy. First negative, HPO axis comes down, window closes. Then it goes for positive feedback. LH surge happens. Got it? No? Very easy. Yeah. Once you go home and just revise in your mind. Books are all there, but books we don't open. I also don't open. Okay. So now this is over. Now LH surge happens. 1 follicle goes out to the tube, and then all that I don't want to repeat again. Last time I repeated. You are all understanding now. From metaphase 1 to metaphase 2 it goes, and then that's what we connect in the IVF. See here I am connecting you for IVF also. See, from this I will take another base for 2 follicles. Okay, I'll start one more and then take this as a base. You till now you're all with me? Yes. Now okay, we'll do some practical things. Now basically I'll give you a general perspective of fertility. Normally, reasons for fertility you all know. Almost 45% is male now. 20 years back it was 20%, now it's 45%. So 55% is female. In that, maximum is ovulation disorders, then tubal problem, then uterine problem, then blah blah blah, many things, endometriosis. Now we will talk about maximum ovulation problems. So I will, I don't want to take this out, how to get another, okay. How to store this, I'm thinking. Okay, let's. Okay, let's again do it. Huh? Now, I'll make this also very easy for you. So, a lady comes to you, basically. She is married for 1 year. And now she wants to become pregnant. Very simple. First is age, you will ask. Second, how many years you are, how many months you are trying, all that. Then, husband's sperm, tubes, all that is okay. First consultation she has come to you. What normally you see, if she is more than 35 years, in 6 months she should get pregnant too. If she is less than 30, she still have time. Don't too much break your head. But on that day, you have to see it is just like seed and soil. A good seed is 50% her genes and husband's gene. That should be good. Soil, endometrium should be good for her to become mother. In between, the seed and soil goes to the soil with a tube. Fallopian. So you have to see these 4 parameters first. Very easy. Put a scan. They won't say. In the scan, your mind should be like, okay, her seed is good now. Egg count. Less than 4, whatever she is, 30 years, 25 years also, warn her. It's our responsibility. Tell her that it doesn't mean that you will not become mother. Even with 0 seeds, they can become mother. But scientifically, that is spiritually. Scientifically, it is don't waste time. Then do an AMH. AMH, you know, less than 1, we have to little hurry them. But don't cause anxiety and fear. See, spiritually, what I believe is something called as manifestation we are moving now. If you tell, somebody tells a lady, you can never become mother, I'll tell you, poor lady, she would have become mother because of her negativity. She has branded herself. And especially when a husband is sitting there and you tell them no, they won't even touch them. You don't know, your words are so much value. So encourage them. Tell them, me job, me 8th to 18th day, alternate days gani. Alternate days becomes, I'll tell you, for a 40 years man, it is too tough. He'll tell, what did you tell to my wife? Alternate days, it's like climbing mountain. So 5 days sperm stays in the reproductive organ, 5 days scientifically. Ovulation time, you see her and tell them, you know, at least weekly twice during ovulation. Anybody, 0 count, 0 sperm also you tell. It's our responsibility to send them with good vibe. See, we are all humans, no. You don't know what all this lady will have after effect. Very bad. We are sending with a negative that for a lady in India, forget about all of us. For India, for her, all their in-laws, whatever rich, poor they are, they want their lineage to continue. This lady is just a source for them, for their lineage to continue. So she won't have respect in the society. We are here to create respect. Behem code, some whatever, I don't know. Yeah. In that we all have to unite. We have to make sure our life is settled. Okay, that is one. What you tell is very important. Now, where was I? The topic? AMH. AMH less than 0.6. They come like this, ladies. I tell them, 0.002 kuda pregnancy ochindi. I'll tell her husband also. I'll show some videos what I have. This lady 0.002, this one, she conceived. So encourage them. See, nothing else they can do. But also make sure that if she can become a genetic mother, you try best. 1 or 2 follicles, don't waste time. That is one. Now, here we have seen first new 1 year married life, she has come. Say suppose scan, you see normal follicles. We'll go with normal first, because if you go to extreme, it takes us somewhere. Normal follicles. Then what you will do? You will tell husband's parameters. So, 3 days abstinence. But again, husband thinks he is blessed with, never. What all that will not be. Essay is important. For tube test doing in the first cycle only is a debatable topic. None of the guidelines has told, first time only you do. See the pain threshold, all that to the patient. HSG, try and learn SIS. I'll tell you, it is 1/10 pain, that's all compared to HSG. I think one thing you have to learn from here is SIS. We all do SIS. And it's wonderful. You can see additions, you can see intra-uterine defects. And you yourself are seeing that lady. So learn SIS. So you see, if you want, you can do the same cycle. Depending upon patient, if she is very aged and she wants, this month pregnancy ravali. Somehow when you flush the tube with SIS saline, sperms go faster. I have seen. In fact, why I can connect all these dots is one of the study published in ISAR in Indian ladies. See, outside tube is not a problem. In India, tube is a problem because of tuberculosis or whatever. So ideally, tube test should be contraindicated if there is a PID, if there is adhesions, if there is any infection. You should not do that. You should be very careful. Already scan me, you are seeing some mass, don't do. You are flaring, you are pushing saline and all that tubes, it goes to abdomen, it causes problem. So be careful. Okay, see that endometriosis also avoid if there is lot of additions. They cause severe pain to them. Now, tube test is you can after 2-3 months also ovulation induction is first thing you will be doing. If SA is fine and follicles are good. If she is already having regular cycles, if you want to increase her pregnancy, try and get 2 follicles. How you will get 2 follicles? Your mind should keep thinking 2 follicles Ravali. But the very first instance you can't put high dose to her. Because you are seeing her today. You call her again, give her normal letrozole 2.5 mg BD. Don't give 2.5 mg OD. They say, but in India 5 mg is the dose. Give her that, give folic acid, all that, and then you call her out. Don't call too early also. Call her on 10th day like that. Already she is ovulating, no? If she has short cycle, call early. If she has a longer cycles, also call her on 10th day, not later. Because if you don't see now what 2 things can happen. On day 10 she has come. Day 2 your scan is all follicles are around. See here also I will give you one clue. The first day 2 scan you be very vigilant. If a girl has follicles 3 to 4 mm, small PCOS, you give 2.5 or 5 mg, it won't even go near that ovary. Because as the follicle become bigger, no, it has more receptors. It is just like that. This is small, it has only this much. If on day 2, if this follicle is 7 or 8, it has more, no, it's big, it has more receptors. So threshold is what? Less for it. So you give little lesser dose, it comes. Now, say suppose on day 2 scan all are like this, you will tell like you will give 2.5 mg and tell, che, what is our science? More bigger follicle, smaller dose, it will come out. These small follicles you have to give little bigger dose. 7.5 you start, see if they come to me, if they don't have time, I will do the scan and I will tell my doctors, hey 2.5, 5 kuda kaadu, 7.5 ivandi. Like that you will become a good doctor, you are saving her 1 month. Got my point? Usually also, this small follicles are for those ladies who have irregular cycles. Remember, long PCOS, 3 months may. This is, window period is when for them? Tell me 3 months may when the window period will start. It is maths question, I am not thinking. 14 days, okay, we will do this for your easy understanding. 3 months. Here 14 day, 14 no? Here? This is 14. So 3 months, 90 minus 14?
45.
Maths, money making maths. 45. Now, this follicular phase, it doesn't mean that yes. I also try to believe it. 76. Okay, 90. So 76 days window period she has. When she comes to you on day 2, where she is poor lady, her window is so much. Give her 75. But see here, no, 7.5, sorry. Here if on day 2 her follicle is little bigger, you can give lesser dose. More, smaller, give her 7.5. What will happen? Nothing, she will not have OHSs. With letrozole, anybody has OHSs. Clomiphene don't give. Clomiphene, if she is thin, no. With 100 clomiphene, she can get all 20 follicles also. Clomiphene causes. Yeah, letrozole have a good mechanism where it doesn't cause OHS. 7.5 letrozole is decent. Like that, you should start thinking your patients how fast you can make her pregnant. Your task. If first time follicles won't come, then I won't tell totally patient's problem, iatrogenic problem also. I'll be very honest with you. Because you have not understood the depth of physiology. Of course, there are some challenges when hyperandrogen is there, high BMI is there. There are 5 conditions where BMI is more than 30, hyperandrogen is there in them, high testosterone is there. Even if I give not 7.5, 10 also she may not. That is left to, but you giving 5 and 7.5 is your, out of say suppose 10 patient who won't get follicles, you are saving 5. Your job done. So like that you should think now. Okay, now you have called her on day 7. Now say suppose you didn't know physiology, you have started 5. mg, you call her on day 7. Still it is, maybe you should measure now. The 3 has become here 6, then take it again. Put 7.5 for 4 more days. Threshold dose was not met. Still you have time. Now say suppose it is still 3, you can make it 10. ఇంకా చిన్నగానే ఉంది. A month you won't be salvaging. Got my point, no? Are you all with me?
Yes, ma'am.
All is the way you see scan. Follicle small, more dose. Follicle big, less dose. Very big, actually you should not do. You know that no, if it is already 12, what are you doing? Causing more problem. So this is what will help you to save every month of the patient. Got my point, no? Say now we will go with a normal month. So day 7, the follicles is already 12. Leave it like that, call her again. During ovulation you call. If it's 20 mm, give trigger. Tell them to conceive naturally. Lucky if you are, things will, especially a lady who is getting irregular cycles, this will help. You may fail for already unexplained infertility. Because already she is releasing month, what great you have done. By chance if she conceives that month, you are happy. So for unexplained on same month you can do tube test. There is the logic now. You got my point. What happens in an unexplained? Sperms are okay, tubes are open, or you have not done tube test, whatever. If you flush, they say the tubes, even if it's open, there is a small flimsy adhesions. Though the open tube, like cobweb, web, sperm can't enter, but your saline flush is entering. So for unexplained, ideally what some study says is even before IUI, 2-3 days just flush little. So you are optimizing the pregnancy. You understood how tube test same month in an unexplained you can achieve more pregnancy logically. This way if you start thinking, no, see I am not telling textbook things, I am telling my experience. Putting all studies, putting patients after 39,000 kids are born. Because see they all come for IVF more because it's a tertiary care center. But I don't want patients who come to you to come to me for the first time only. See, out of say suppose you see 10 patients, 7 should become pregnant in your own clinic. That is your value adding to the society. Got my point? So this is how if you do, most of the patient conceive. One tube test when ovulation, what dose, this is all OI. Okay? So now this one part story. Now I'll tell you. Generally 1 year she has come, married life, everything is fine. Now say suppose she says, okay, we'll go like this now. Now your task is to figure out in the first time when she comes what is her problem. I know you're all going to have very busy life, I pray for that. Busy and balanced life. What I have learned is it's not only busy, it has to be balanced. In your balanced life, maternity plays a major stressful game. Delivery, when it happens, you will forget every counseling fertility. So, but still if you have an idea that first day patient comes, I have to put her in this group, fitting her. How you fit her? See, ovulation, disorders, unexplained, endometriosis. Then what else can happen? Ovulation you finish. What else can happen to a lady who comes? Problems, tubal issue, uterine issue. Then what else? Anything I missed for a lady? Yeah, that all comes in uterine issue. Good, you told me. Now you have to put first scan me what you can see. Normal. You can rule out certain uterine issues, fibroid, all that. Scan me. And also follicles you can see PCOS or POR. Need not be day 2 also. Generally you can see idea. Now another thing you should also understand is you should know the normal form of ovary where they are. if it is pulled up, adhesions. See, endometriosis, you know what, I felt very bad. It takes 7 years to identify endometriosis because stage 1 and 2 are not seen in scan. Until and unless later laparoscopy they find endometriosis, which can't be picked up in scan. You all know endometriosis. So, grade 1 and grade 2 where there is only pain, dysmenorrhea, dyspareunia, it's our time to pick it up and do a scan and do a sliding sign. See, if you go to behind the uterus, what is that space called as? Pouch of Douglas. Below that ligaments are there, no? Uterosacral ligaments are the first place where it gets deposited and the ovary comes and gets stuck there. You got my point? So now you can't see endometriosis in scan, but when you do a scan, you will see ovary ikkada kada ikkada enduku undi. Ee ammaiki pain unda. There and then when I do scan, no, I'll ask pain unda. When you are together, do you have problem? There and then I know stage 1 endometriosis she has. So what I do, I'll put her to this basket of endometriosis. So treatment will go phased on that endometriosis. I'm not wasting her time. Like that you have to see in scan what all you can, where to put this lady. Adenomyosis also. See, so many times I don't know, all ladies because of microplastics or whatever, they're all, who comes to us are having adenomyosis. That's the toughest battle actually. So early stage of adenomyosis little create seriousness in that lady. Means, see, you have to balance seriousness. Again, you can't, you have to balance. No? She's a human being. First time she has come. Imagine first time you go to one doctor and she tells all things, they get scared. Parents, they like their kids so much, they'll tell too much. Kids get scared of parents. You have to get that vibe with them. So, we balance and now, okay, endometriosis, early stage, here my task is not, you have a 7 centimeters endometriosis, I found out, that anybody can find. Radiologists can find. What am I? I'm a specialist for pelvis. Hidden things I should be able to see in my eyes. Sixth sense they call it as. That has to sharpen in us. He has not found, I have found. That is the credit. You feel proud about your own self. Nobody has need to praise us. If we do something extra to the couples, no, we feel so happy inside. So that endometriosis, fine. Now next scan me, you can see all this. Tubes, if it is swollen, hydrosalpinx, you know tubal problem, it goes directly to. Okay. Now, in the scan, say suppose she has come on 21st day. Ideally, what should be her endometrium? 8, 9. What if it is 5? You have to now keep in mind, ikkada soil problem undi. Your all one scan should tell the whole things to you. Your thinking process should go like that. Oh, idi correct avvatledu, CL cyst ledu, ovulation lo problem, 21st day. Endometrium manchiga ledu, endometrium lo problem. Like that, which day scan you should come to picture in your mind. Oh, ee roju ovulation ante before I see patients, I'll see history and go. Oh, ilage undali scan. Ledante ento problem nadustundi tan body lo. Pillal, see, normally 1 year if they have not used contraception, if sperm is okay, 76% have to conceive according to NICE guidelines. We know that. So first year we are dealing with some lady who has really a problem, and it's our job to identify. When you know the problem, you have solution. If you don't know problem, there is a blanket treatment. So second year 92% will conceive. Third year only 8%. There will be some problem. What is it? We have to find out. Okay. Now, next is, okay, uterine, when it is thin or whatever, you have to at least classify. First day only you have to make a note, uterine issue undochu. Then next is about, okay. Now, we will come to this ovulation part. So, how do you know she has an ovulation? I am covering an important topic. Actually, this is my topic for today. but I go here and there, but I feel that will add value to it. It's not simply coming and talking, no. It is how to get the best for an ovulation. Now let me tell this also very easily so that you don't have to read. You know all WHO type 1, 2, 3, 4, 5 for our understanding, 6 I took usually. Okay, you know 1, 2, 3, 4 what they are WHO? First is what? No decoder, HH, very good. Second? Very good, hyperandrogenism. PCO is 95%, 5% are other things also, which we don't want to talk much. Third, very good, ovarian, premature ovarian insufficiency. Fourth, prolactin thyroid. Fifth, just for completion, I am given endometrial issues. This is not there actually, okay, just for us, our completion. Now, okay, we'll do one story now. Oh shit. One lady comes to you. She says, no, anovulation I'm talking. First case I told ovulation. She has regular. Now one lady comes, she says, I'm married for 3 years. My cycles are once in 3 months. So where will you categorize her as? Anovulation. Because 3 months we know she's not ovulating. Now what do you do first? We'll be very practical. Nice. One by one we will take. So that you are all sharp. Okay, we come to madam. Now lady comes. Normally, see, we are not here to demean anybody. We have to remember by making mistakes also. See, I like people who talk and make mistakes because there becomes the charm of the class. People will remember how the cheppindi kada. So your agenda is to remember. So say suppose 3 months she has not had cycle and she comes to first thing what we will do normally as a gynecologist. Before that, first thing, even if husband is not there, you should think that that's what they say. So madam does UPT. Now UPT is there's a positive, then that patient goes away, she'll be very happy, call puttam wale pinchi vachesi. Madam chala lucky now. And she'll tell them about you and some 2-3 extra patients will come. That is a lucky zone we are walking in. Now say suppose patient is negative. Now patient UPT negative, then she will ask cycle raledu, you will tell pregnant kaadu, then she will tell em cheyali. What you would first do in your clinic?
I will see her how she uses it. She's having.
No, just wait. I don't want you to use science now. I want you to be childish. Just in the your sitting patient is there. Normally you think I am only patient. What you will tell me? Like we'll do role play. Oh no, periods raledu em cheyali ippudu. Pregnancy అయితే negative. What you do? Normally what do you tell her? Scan. అవునమ్మా నాకు తెలియదు ఎందుకు నేను నిన్ను ఫస్ట్ టైం చూస్తున్నా నాకు తెలుసుకోవాలి కదా నీ గురించి come on let me do a scan. If you are scanned there you will put a scan probe. Then what ideally you will see in the scan? Endometrium super follicles and all you don't know what. So you pregnancy అయితే negative ఉంది. Thick endometrium pregnancy we have ruled out. That's why first is pregnancy. Now she will come. Okay, you madam scan అయిపోయింది కదా ఇప్పుడు ఏం చేస్తారు? What will you do? Super withdrawal. So normally what I will do, I will also tell you. I tell amma pregnancy ఉండొచ్చు నాకు తెలియదు ఈ మెడిసిన్స్ తీసుకో ప్రెగ్నెన్సీ ఉంటే కూడా 2 in 1 because if I give medicines I think pregnancy ఉన్నది కూడా పోయింది. I have learned all this by calling down and I'll give little safer one. I won't give primary tell because she is coming for pregnancy. I'll tell her ఇది తీసుకోమా ఇప్పుడు ఇది వదిలేసిన తర్వాత 5 days వెయిట్ చేయి. That also is very important. Otherwise she will leave and she will tell periods ఏ రాలేదు మేడం ఏమి ఇచ్చారు. So you should tell clear instruction. ఇది ఈ డేట్స్ నుంచి ఈ డేట్స్ తీసుకో ఇది వదిలేసిన తర్వాత 7 days వెయిట్ చేయి. బై ఛాన్స్ నీకు ఇంకా పీరియడ్స్ రాలేదు ప్రెగ్నెన్సీ ఉండొచ్చు ఇంట్లో ఇది 2 in 1. Then ప్రెగ్నెన్సీనే లేదనుకో పీరియడ్స్ వచ్చేస్తుంది సెకండ్ డే రా. That communication if you give no, why I'll tell you all this why I have learned is because I'm managing 38 doctors. New doctors who comes no, patient who they have come from first so Gujarat some patient had come seeing our endometriosis video. They didn't tell clear information. Patient papam last day of Meprate came next day. For me my heart started like chi papam. Proper information is with. See we all also to come today here, how much trouble you would have taken, how much plan you would have done. Patients are also like that, no. If I feel it's a crime on myself if I don't train my doctors and waste somebody's one day. See, in the nature wise, we are all not only doctors, no, we are human beings. Everybody has work. Papam, that people, they book their train. All this is because I was thinking, are na communication problem. So please communicate to them. They are all good people. Tell them, wait, pregnancy test chesko. Cheste kuda ra na దగ్గర ఎందుకంటే folic acid start చేయాలి. Negative ఉంటే కూడా రా. Periods వస్తే కూడా రా. Give clear. No, okay. She has done her job. She has told clearly. Patient gets cycle. Now she will come to you. Now ఉంటే నా ప్రెగ్నెన్సీ అయితే రాలేదు. ఇప్పుడు వచ్చేసాను. ఏం చేస్తాను? నాకైతే ప్రెగ్నెంట్ అవ్వాలి. So where do you categorize this patient in all these groups? That's your idea now. Now I am doing that role play and getting you back to understand science. Now you tell that patient where you can categorize her as. This is ruled out uterine, not thin endometrium. Hyperpro, okay, yeah. Before that, you have to rule out. First time when any lady comes with anovulation, it's our responsibility to rule prolactin endometrium. I'll tell you one case also about hyperprolactinemia. I'll give you one example. Okay, what happened? One lady, she came 8 years back. Everywhere they had written hypoplastic uterus, 3 centimeters, 3 centimeters. I don't know. That the husband came, he told, I'm divorcing her, full like big mela it was. Then they told, the patient ki chala chinna garbhashayam pregnancy raadu, and they give HRT, they give so much HRT. I'll tell you, HRT when you give, OC pills, not HRT. OC pills causes thin endometrium, it shrinks ovary. You all know. You know, Marina, if you put what happens to a lady, she starts, yeah, no ovulation thing, uterus shrinks. From 6 centimeters it becomes 4. So for this lady, already prolactin was very high, not very high, it was 80, 90, 100 something. But they had given, she was not getting cycle, hyperprolactinemia causes anovulation, we know that. Normally if somebody has missed that, what they will do, cycle out their OC pills. With hyperprolactinemia, with OC pills, uterus more shrinks. When she came to me, it was 4.3 centimeters. So every scan, radiologist, hypo, diverse now. 3 years. Now, I was like, I also first time, my first thing was I didn't know history. Neither I know prolactin is in, neither I know uterus, what is the problem. My work is to make sure that life is safe. So I told, give me 3 months. Buying time is most important when somebody comes from Panchayat. And studying, really, I have learned all this. Then you tell, more than a time in Tarata Mishta. Then what time sat with that family ladies and then little analyzed there was hyperprolactinemia with 2 years or sometime in between OC pills. Then I told stop all this. I know because of that OC pills eggs will shrink. I know I can't get her genes. Maybe if I had seen her 2 years before she would have had AFC. Because of iatrogenic ovary has shrunk because of continuous OC pills. Now I don't have time. I'll tell you very honestly, I did donor cycle for her. I told, nee uterus ni nenu, I stopped OC pills, slowly it started. 2 months is enough, it will come back. Then hyperprolactinemia I corrected. Little it became, there was no triple line in her all history. I had seen so many scans. There go no mela everywhere. Then suddenly she started getting triple line. That was very encouraging. And it became 4.5 to 5 uterus. Then I thought, 3rd month over, my neck was there. I still got some age and come to bow me, 2 months wait changing. The fellow was like irritating me. When they are not there, in between he used to come. Because I have to balance no between them. Then what we did, I told, okay, those people were ready to, put money. Donor egg I got, husband's sperm. He was not bothered. He told, na jeans na kaval. She's nice lady. I don't have problem. Then I told her, Nico, next year cheskoma pregnancy, first me life set avali. Then what happened? Endometrium became triple line. It came till 6.2. For me at that time 6.2 was scare. I had never done then. Now even at 5.8 knowledge me 2 minutes. So then what happened? 6.2. I did Om Namah Shivaya and I transferred. She conceived. She conceived very happy, full. They were so happy that I was in my mind palpitating. Amma chinna uterus, chinna endometrium, yemoutado. Then referral doctor I sent her, and I forgot the story. See, after 4 months, I will also forget, no, because it's gone to refer a doctor. No, 7.5 months, water break, patient delivers, she did cesarean, and she put me a message. ఈ చిన్న యూట్రస్ లో ఎలా పెట్టాం బేబీని. దెన్ ఐ టోల్డ్ ఇప్పుడేముంది డబ్బాలో పెట్టు బేబీని. Then you know that kid is so active, very active. Whenever I see, they'll come in between, full like that zamindar type for advertisement. Amma, then I'll be thinking, this story will not tell you actually. I know that story, no? Some stories in our life become memorable. So, like that, it is, see what we want, one kid with his genes she got. Now, I don't know. I have like not followed. She came, she didn't conceive naturally, I don't know what is. But for their story, it ended like this. So hyperprolactinemia, I am giving you the importance. It can mess up. I have told you the full story of hyperprolactinemia. So be careful. And when high prolactin also, don't induce too much. First get the prolactin, get it, because it causes anovulation. And it causes thin endometrium. And this is a vicious circle, okay? So it is we finished that case. Of course, what to give medicines, all that you know, cabergoline weekly twice, 5 mg, 2.5 mg, you know the evidence. That's all you have to do, 8 weeks you have to give, follow her up, that's all. And when they do prolactin also, that's you know, breast stimulation, stress, all that can increase. Early morning they should do prolactin test also. That is the theory part. No over. So this case, now I am here with this doctor. So now she has come, you have done her prolactin thyroid normal. 3 months she didn't get cycle, now she got cycle. So this you have ruled out. So now you have to put her in this. Where will she be? Now 3 months amenorrhea, 3 months amenorrhea, thyroid prolactin normal. After withdrawal she got cycle. So where does she belong? Mostly PCOS. Because you have seen her endometrium thick secretory. All that you are connecting. So now she is PCOS. Good. You give her medicine, then to next class I will continue how to PCOS per se ovulation. Now today's class is WHO type, how to come into conclusion which type it is. Okay. Now okay. So another lady, she comes to her and she says, మీరేదో టాబ్లెట్ ఇచ్చారు 3 months తర్వాత 15 days అయింది ఇంకా సైకిల్ రావట్లేదు. This can happen, no? So what usually you will think, అరే నేను ఇచ్చాను కదా withdrawal, తనకు వచ్చింది, ఈ పేషెంట్ రాలేదు ఎందుకు, another patient. So what you will start thinking in that?
Endometrium is not estrogen primed for the
Superb.
progesterone.
Very nice, you deserve a clap. So it is a hypoestrogenic state of uterus you are seeing. It can be a prolactin problem, it can be a HH problem, it can be even a POR problem. So now how do you differentiate? Now again, what should you do next? If it is a hypoestrogen, what will you do? She is sitting in front of you. She told, నాకు తెలియదు మీ hypoestrogen నాకు మెడిసిన్ ఇవ్వండి, నాకు పీరియడ్స్ కావాలి. What will you do to her? What normally you give? Yeah, estrogen, valerian, maybe succinate, all that you don't bother, which is cheap and which doesn't cause side effects. Give them 2 mg 3 times a day. See, that time what you should do, redo a scan. If you see a very thin endometrium, again don't waste their time by giving 10 days. If it is thin, but when you start estrogen, your responsibility is to rule out DVT risk. Your responsibility is to rule out migraine risk. And you have to tell her, don't sleep with this tablet. Lena problem we have, see in my life, there is one patient who went with one injection of HMG, US patient there, this big long letter to us. So much we asked, but still she had a brain thrombosis. You know, we could not sleep. One of the consultants' patients it was. We are so fed up with that patient. We started praying and the doctor were told, I'll go do some omam also if she recovers. See, we are also human, no? For patient what? She came all the way from USA, ikkada vachi o chinna injection no DVT ayipoyindi. So because it was admitted in Yashoda, doctors also told HMG injection we give that to 150 only. We didn't even give estrogen. So I'm giving my case in, but I'll tell you, this is one in 4 lakhs couples I've seen. Don't get scared. one patient becomes so strong a memory in your brain. But as a rule of thumb, so patient's husband was connected to us. He was telling me Radigari history. If I had not asked, my guilty also no. At least I am free of guilt. I am science academic. I have put my here. So like that, ask them before you start one estrogen tablet also. DVT, migraine. Don't ask them to drink lot of water, not to sleep. Try and give an ecostomy. I give. Science doesn't help us. Show it helps. I'll be very honest. But I don't know. I have always done that. So then she gives estrogen. If very thin, give for a longer duration, 2 mg. Don't start OC pills to get cycle. That shrinks the endometrium. Start estrogen, prime it for 10 days, call them 20 days. You see endometrium, it will start swelling. Then you give progesterone. Or if they say I am very far, I can't come, after 20 days, together with progesterone, then she will have withdrawal bleeding. Then where do you call her? In which group? HH or POI? Yeah, you also don't know, I also don't know. Call her on day 2 because it can mimic different ways. But scan may there is a hitch. See why I tell you this HH also I will cover. Scan also there is a hitch where you can't categorize. Say suppose you may think POR. When you do a scan for her before giving HRT, thin endometrium, less follicles means you think POR. But there is a type of HH where we call it as a good HH and bad HH. Bad HH mimics POR, small follicles, small endometrium. So you won't know whether it's a bad HH or a POR. So call her on day 2 now. When you call her on day 2, your marker will be which test, one marker to differentiate HH and POR. One marker. Wow, you are connected. I'll clap for all of you. FSH. What happens in a HH for an FSH? How low? So day 2, you get a low, less than 2, you brand her as HH. Your FSH is 25. You got my point? Very simple. So this is how you have to fit her in all the group. Now another, you know WHO type 1, type 2, type 3, type 4. You are all okay? Right? Now another lady comes and she says, ఏదో ఇస్తానే ఉన్నారు టాబ్లెట్స్ 3 months ఇస్తున్నారు ఆ హెచ్ఆర్టీ అంటున్నారు ఈ హెచ్ఆర్టీ అంటున్నారు ఈ మేడం వేస్ట్ షీల్ గో టు అనదర్ డాక్టర్ దే స్టార్ట్ ఓసీ పిల్స్ ఫర్ దెమ్ అగైన్ 6 months లేటర్ షీల్ టెల్ ఇక్కడ కూడా రాలేదు మీ దగ్గర వచ్చాను మళ్ళీ so much you do, you give estrogen, you give progesterone also, she won't have cycle. Then where you will categorize her? Not in WHO. You will have to go with it is uterine cause. Basal layer of this endometrium is gone because of various reasons. Basal layers, iatrogenic is not going nowadays because people know the importance of the endometrium. They are very guarded and very careful about the endometrium. Not doing too much DNC, not doing hysteroscopy to people current. If the basal layer dies, you give estrogen of the world, she won't get cycle. Basal layer is not there. Through basal layer only it has to rejuvenate for proliferation. So in that lady, whatever you give, endometrium won't happen. Then you have to post her for hysteroscopy. See what is the reason for her basal layer damage. Be very clear on that day. Septum can happen sometimes infections can happen, some partially removed septum adhesions which forms, something has happened to that endometrium. TB can cause in our country, severe PID can cause, which cause endometritis, a course of antibiotic, all that you have to give them. This is the whole normal, you have to first day of a lady, you should keep this in mind, where will I categorize her, because from there like a Google map, it can go to Karimnagar, it can go to Kamareddy, like that, it can go to different angle of treatment. If this place only you don't know, then shooting in the dark. So I think I told stories, I got you into the groove of becoming a good doctor. If you even just pass in IMA exam, and if you become good doctor, my job is done. got my point. Thank you, thank you. Try and come for physical classes because this much connect. How much ever I put my energy, it won't connect. Monthly once we will do. From now I will start this all type of ovulation problems. What medicines we give. That will be my next class. Male infertility also, whatever andrologists speak, I will cover in my own different way. For you, when somebody comes with azo, oligo, you can connect. So having said that, October 11th and 12th, we have our Pratigna. We are sincerely making a very good attempt to get you world-class doctors. See, Manish Banker sir is NOAA, 136 centers he has had, good science. Jatin Shah, he is very good in his academics. I'll share the brochure in the group. I feel not only you have to get your friends also. It will be a very good base for you. See, going to ISAR, IFS, you should go. But once you get a base of fertility, it becomes easy for you to pursue. 2 days block your calendar. I'll be trying to give summary of each session, could take home. And based on that, another class we will have here discussing ISHRE, ASRM, what new guidelines, what all. So please do come and motivate your friends also. Right? Thank you. Thank you.